Welcome back to Medical Terminology. Today we're going to discuss Chapter 11, the cardiovascular system. Let's get started, shall we? Learning outcomes. 11.1, we're going to identify and discuss the structures and function of the cardiovascular system. 11.2, we will define combining forms used in building words that relate to the cardiovascular system. 11.3, we will summarize common diagnostic tests, laboratory tests, and clinical procedures used in testing and treating disorders of the cardiovascular system. 11.4, we will define the major pathological terms of the cardiovascular system. 11.5, we will define surgical terms related to the cardiovascular system. 11.6, we will recognize common pharmacological classifications used to treat disorders of the cardiovascular system. And finally, 11.7, we will identify common abbreviations associated with the cardiovascular system. All right, let's dive in. Learning outcome 11.1, structures and functions of the cardiovascular system. As we know, the cardiovascular system is responsible for delivering blood to the body. It also carries nutrients and oxygen to the body, as well as removes waste and carbon dioxide. Let's discuss the blood flow of the human heart. The diagram here shows the process of blood flowing in the human heart with 8 labels clockwise as follows. Oxygenated blood from the lungs, deoxygenated blood to the lungs, deoxygenated blood from the upper body, oxygenated blood to the upper body, deoxygenated blood to the lungs, oxygenated blood from the lungs, oxygenated blood to lower body, and deoxygenated blood from lower body. The upward arrows show an outward flow of blood, while downward arrows show an inward flow of blood. Therefore, the heart is an organ that pumps blood throughout the cardiovascular system. It is composed of left and right sides. The left side is responsible for receiving oxygenated blood from the lungs and pumping it out into the body. The right side of the heart receives deoxygenated blood from the body and sends it to the lungs so that the process may reoccur. Building your cardiovascular vocabulary. First, here we have angio, which means blood vessel. Aorto means aorta. Arterio or artero mean artery. Athero, don't get these confused, they do look similar in spelling, but athero means fatty matter or fat. Atri, which is the atrium, atrio. Cardio means heart, can also just be cardi. Hemangio is blood vessel. Remember, hemo is our word part for blood, angio is vessel, so therefore we got hemoangio is blood vessel. Then we have pericardio, which means pericardium. That's the layer that surrounds the heart. Remember, peri is our word for around, our prefix. Phlebo, phlebo means vein, hence the term phlebotomy. I'm sure you've heard of that. Sphygmo, sphygmo means pulse. And we will talk about that with the sphygmomanometer. That's the technical term for a blood pressure cuff. Thrombo, thrombo means blood clot. Vaso is blood vessel, and veno is vein. So keep vaso and artero separate. One's artery, also angio. Artero, angio, and vaso. Here we can look at the layers of the heart. Remember that peri means around, cardium, so it's referring to around the heart. So the pericardium is kind of like a sac around the heart. Then you can see within that is the parietal pericardium. It's a thinner layer. And then you can see endocardium. Remember, endo means within, so this is the inner layer of the heart. Myocardium, myo means muscle, so this is the muscular layer of the heart. And then at the bottom we can see the epicardium, which is the visceral pericardium. So remember, epi means upon or over, so this is on the outside. All right, heart valves, we have 4 chambers. 4 valves allow blood flow in one direction. Pulmonary, aortic, tricuspid, and mitral valves. Let's look at those valves. So here you can see the valves. Blood is pumped through the 4 heart chambers with the assistance of 4 heart valves: the pulmonary valve, the aortic valve, the tricuspid valve, and the mitral valve. The structure of the heart consists of fibrous rings to which the heart valves are attached. Here are terms you're going to see with structure and function: valves, arteries, veins, endothelium, lumen, arterioventricular valves, tricuspid valve, bicuspid valve, mitral valve, semilunar valve, pulmonary valve, and aortic valve. Vessels of the cardiovascular system carries blood within the heart to the tissues and organs, and they also expand and constrict to regulate blood flow. Let's look at some major arteries here. We're going to start at the top and work our way down. First, we have the subclavian artery, the aorta, which is the size of a garden hose, it's actually quite large, the coronary artery. Then we're going to move over to the brachial artery, which, remember, brachy means arm. Then you can see we are going to the renal artery, which is in the middle with the kidneys, and we'll go back to the arm for the radial artery. Then moving lower, we have the femoral artery. Then we have the popliteal artery that runs behind the knee, and the posterior tibial artery, which goes behind the tibia. And finally, ending with the dorsalis pedis artery. Now let's look at some major veins. Starting at the top, moving down. We have the internal jugular vein, which is found in the neck. We have the subclavian vein. Then we have the superior vena cava. This is what delivers that deoxygenated blood to the heart so that it can be pumped to the lungs. Then we have brachial veins and renal veins. We also have the hepatic vein, which remember, hepat is our liver, so that is the deoxygenated vein that's coming back from the liver. And then we have the inferior vena cava. You'll notice deoxygenated blood comes in from 2 directions here. Then we have the femoral vein, the popliteal vein, and the anterior tibial vein. Notice we also have the great saphenous vein as well. Blood vessels of the heart. The anterior view of the heart, labeled A, shows various parts labeled clockwise from the bottom left as follows: the inferior vena cava, right coronary artery, the right pulmonary veins, the right pulmonary artery, superior vena cava, aorta, left pulmonary artery, left pulmonary veins, left coronary artery, and left anterior descending artery. In the posterior view of the heart, labeled B, it shows various parts labeled clockwise from the bottom left as follows: left ventricle, cardiac vein, circumflex artery, left auricle, left pulmonary veins, left pulmonary artery, aorta, superior vena cava, right pulmonary artery, right pulmonary veins, left atrium, right atrium, inferior vena cava, coronary sinus, and posterior descending artery. Blood pressure and conduction system. Pressure in the arteries is measured with a sphygmomanometer. That is also known as your blood pressure cuff. A lot of times this is used in conjunction with a stethoscope. This system also controls electrical impulses. Conduction system. The parts of the heart are labeled clockwise as follows: right bundle branch, AV bundle, junctional branch, AV node, SA node, interatrial septum, left bundle branch, interventricular septum, and Purkinje fibers. The arrows show the direction of the blood flow in the heart. The conduction system flow is as follows: the SA node, the atrial syncytium, junctional fibers, the AV node, the AV bundle, bundle branches, Purkinje fibers, and ventricular syncytium. Fetal circulation is the circulatory system of the unborn child. The fetal circulatory system consists of the ductus arteriosus, pulmonary artery, pulmonary veins, foramen ovale, lung, heart, liver, ductus venosus, urinary bladder, umbilical cord, and placenta. Learning Outcome 11.3, Diagnostic, Procedural, and Laboratory Terms. Diagnostic, procedural, and laboratory findings assist the physician in diagnosing medical conditions, can also confirm a final diagnosis, assist in the treatment planning through electrocardiogram or an angiogram. Learning Outcome 11.4, Pathological Terms. Heart rhythm, the sinus rhythm can be normal, where abnormal rhythms can be life-threatening. We have things such as risk factors, arrhythmias, bradycardia. Remember, it's not the Brady Bunch, and brady means slow. And then our opposite or opposing term is tachycardia. Remember, tachy means rapid or fast. Then we have atrial fibrillation, dysrhythmia. Remember, dys means bad or painful. Then flutter, bruit, and murmur. Rub, gallop. Palpitations. Palpitations can usually be felt by the patient. Arterioventricular block, heart block, premature atrial contractions known as PACs, and premature ventricular contractions known as PVCs. Now let's go over some blood pressure. Elevated blood pressure can lead to cardiovascular disorders. Low blood pressure is usually not treated. Having too much blood pressure can lead to hypertensive heart disease. Hypertension is when there is a high blood pressure. Remember, hyper is excessive, more. Hypo, less than, right? So this is a low blood pressure. Then there's also such thing as essential hypertension and secondary hypertension. Secondary hypertension is in response to something else that's going on. So say you're in pain or something, your blood pressure will naturally be up, so that can increase that blood pressure. But that would be secondary because it's due to something else. Diseases of the blood vessels. So blood vessels carry blood throughout the body. Damaged blood vessels compromise the flow, decreasing the oxygen delivered to the tissues and organs. Artery, heart, and lung disease. Heart and lungs work together to provide oxygen. Inadequate heart function can cause lung disease. Valve conditions. Valves are responsible for maintaining blood flow. Decreased valves cause cardiovascular symptoms, because you can imagine that it's not letting through as much blood as it normally would. Learning Outcome 11.5, Surgical Terms. So we have cardiovascular surgery, blockages within the cardiac vessels, disorders of the heart valves, an angioplasty, intravascular stent, a bypass, CABG, abbreviation, which stands for coronary artery bypass graft, heart transplant, endarterectomy, and venipuncture. Learning Outcome 11.6, Pharmacological Terms. Medications can treat CV disease and symptoms. Remember, CV is cardiovascular. We can do this through drug therapy, angina, heart attack, high blood pressure, high cholesterol, congestive heart failure, rhythm disorders, and vascular problems. We have such therapies that we can use, such as anti-anginals, thrombolytics, vasodilators, diuretics, and antiarrhythmics. Learning Outcome 11.7, Abbreviations. So here you can see we have AV, arterioventricular, BP for blood pressure, CAD or CAD for coronary artery disease, CPK, which is creatine phosphokinase, LDL, low density lipoprotein, remember lipo is fat, MI, myocardial infarction, this is also known as a heart attack, PTCA, percutaneous transluminal coronary angioplasty, SV, stroke volume. All right, chapter review. 11.1. The function of the cardiovascular system is to deliver blood to tissues within the body. This serves to provide the body with oxygen and nutrients and remove waste materials and carbon dioxide. The heart is the organ that pumps blood throughout the cardiovascular system. 11.2. Word building requires knowledge of the combining form and meaning. 11.3. Diagnostic, procedural, and laboratory findings assist the healthcare provider in diagnosing medical conditions. Often used in combination, these tests lead to a final diagnosis and assist in treatment planning. 11.4. Pathological conditions of the cardiovascular system may affect cardiac rhythm, blood pressure, blood vessels, and coronary arteries, and may cause heart and lung disease. 11.5. Cardiovascular surgery may be performed to treat a variety of disorders, including blockages within the cardiac vessels and disorders of the heart valve. 11.6. Medications may be used to treat cardiovascular diseases and symptoms. Many cardiovascular medications may treat more than one cardiovascular disorder. Drug therapy for the cardiovascular system generally treats the following conditions: angina, heart attack, high blood pressure, high cholesterol, congestive heart failure, rhythm disorders, and vascular problems. 11.7. Abbreviations are used to describe diseases, conditions, procedures, and treatments associated with the cardiovascular system. All right, everyone, that's all I have for you today. Thank you so much for joining me, and please feel free to reach out if you have any questions. Thank you so much for joining me.